Okay, so when I say the word hypnosis, what's the first thing that pops into your head? Is it, the swinging pocket watch, the whole you are getting very sleepy bit, or maybe someone on a stage clucking like a chicken? Yeah, for most of us, that's the image, right? A bit of mystery, a lot of spectacle. But what if I told you that behind all that stage show stuff, there's a really serious clinical practice, one with a long history of actual therapeutic use? Well, today we're going to pull back that curtain. We're diving into the Handbook of Hypnotic Suggestions and Metaphors to figure out what's real science and what's just show business. Let's get into it. So, this really gets to the heart of it, doesn't it? Is it mind control or is it actual medicine? I mean, are you just handing over the keys to your brain? Or is this a legitimate therapeutic tool? That popular image, it's all about submission, losing control. But as you're about to find out, the clinical reality, it's the complete opposite. All right, this right here, this pretty much busts the biggest myth right off the bat. Look, stage hypnosis, that's for entertainment. It's theater, plain and simple. It's all about the drama. But clinical hypnosis, that's a whole different ballgame. It's a team effort, a collaboration between you and a therapist, working towards a specific therapeutic goal. And here's the kicker. It's not about losing control. It's actually about gaining control. So what are we actually talking about here? Well, at its core, clinical hypnosis is all about a state of super focused attention. You know that feeling when you're so wrapped up in a great book or a movie that the rest of the world just disappears? That's kind of what we're talking about. It's a natural state, and in therapy, tapping into that focused state makes your mind more open, more receptive to helpful suggestions that can manage some very real health issues. Okay, part one, healing the body. Let's talk about how this stuff works in the real world. We're going to start with how this state of focused attention can actually influence our physical health. And some of the ways it does this are pretty surprising. Whoa, okay, let's just stop and look at this number for a second. 69%, according to the handbook, and they looked at over 1,000 cases. Nearly 7 out of 10 women were able to use hypnosis as their only anesthetic during childbirth. That is wild. This isn't just, breathing and relaxing. This is a powerful, powerful demonstration that your mind can literally change how you perceive pain. And it's not just childbirth, not by a long shot. This mind-body connection gets used for so many things. The handbook talks about everything from managing pain when you're at the dentist, that drill sound, to actually reducing the symptoms of skin issues like eczema and warts. It's even used for things like irritable bowel syndrome, sleep problems, and high blood pressure. I mean, the versatility here is really the key takeaway. And one of the most compelling examples, I think, is how it's used with cancer patients. For anyone going through chemotherapy, the side effects can be just brutal, sometimes as tough as the disease. Hypnosis can be this incredible tool for them. It gives them a way to get back some control and manage horrible symptoms like nausea, which can make a world of difference to their quality of life. So how does that even work? Well, a lot of the time, it's through really powerful metaphors. Think about it. Your subconscious mind doesn't really respond to a direct command like, hey, stop feeling sick. It just doesn't work that way. But it speaks the language of images and stories. So if you guide someone to visualize their nausea as a raging storm on a lake, and then slowly imagine that storm passing, the clouds parting, and the lake becoming perfectly calm and clear, you're giving the mind a blueprint. It's a way to turn a symbolic idea into a real physical change in the body. All right, so that's the body. Part two, soothing the mind. Let's shift gears and look at how these exact same principles, using symbolic imagery, can help heal emotional wounds. This quote from the handbook really nails it. It says that symbolic imagery can create potent therapeutic change, especially with emotional distress and trauma. It's the same idea as before. We're using images and symbols to talk to the parts of our brain that don't run on logic. The parts that run on feelings, on deep-seated memories, on symbols. Here's a classic example you might have even heard of, the red balloon technique. It sounds simple, but it's actually pretty profound. You imagine a negative feeling, let's say anxiety or maybe guilt. Then you mentally put that feeling, all of it, inside a big red balloon. And then you just watch yourself let go of the string. You see that balloon float up, up, and away until it's just a tiny dot and then gone. By turning the feeling into an object and releasing it, you can create a symbolic and often a very, very real sense of letting go. And this toolkit of metaphors is used for a whole spectrum of things. We're talking about everything from common phobias, like being terrified of the dentist, all the way to the really deep, complex work of helping veterans and trauma victims process PTSD. It gives them a safe way to approach these incredibly difficult emotions and start to reframe them. Things like the door of forgiveness metaphor can be huge for self-healing. Okay, we've covered the body and the mind. So part 3 is all about changing habits and performance. Let's dig into how you can use this to reprogram your mind for success, to break those habits you don't want, and even boost your performance. This is so interesting. Look at the numbers for quitting smoking. If you go for just one session of hypnosis, the success rate is around 21%. I mean, that's not bad, but look what happens when you commit to multiple sessions. The success rate shoots up to 64%. That's a huge jump. It really drives home the point that this isn't a one-and-done magic trick. It's a process. It's about reinforcement, about teaching your subconscious a new way to behave over and over again. Another really big area where this is used is with obesity and eating disorders. And for this, there's a really cool technique called the computer metaphor. The whole idea is to think of your mind as this incredible organic computer, one whose software you can actually update. And this is what that looks like in practice. You literally identify the old, buggy software you want to uninstall, things like mindless eating or using food for comfort. Then you choose the new programs you want to install, like being a mindful gourmet eater or dealing with your emotions directly, or building a more positive self-image. It's a really empowering way to frame it, don't you think? You're not broken. You just need a software update. Okay, up to now, we focused on all the incredible potential here. But to get the full picture, we have to take a sober second look. We need to talk about the pitfalls, the limitations, and the ethical lines that practitioners have to walk. So let's get into our final section, the power and the pitfalls. One thing the handbook is really clear about is that hypnosis is just one tool in the toolbox. It's not the only tool. It's super important to put it in context with other proven treatments, like cognitive behavioral therapy, or CBT. They work differently, right? Hypnosis is all about suggestion and the subconscious. CBT is about identifying and changing your conscious thoughts and beliefs. And for some things, like anxiety, there's a mountain of evidence that shows CBT is extremely effective. So the big word here is caution. This is not a magic wand. Success isn't guaranteed, and it really varies from person to person. And this is critical. It should always be used to complement standard medical treatment, not replace it. And there are real risks. Probably the biggest one is the danger of creating false or warped memories, especially when using techniques like trying to regress someone back to their childhood. You know, the source material gives a nod to critics like Elizabeth Loftus, who is a giant in memory research. Her work basically proved how easy it is to plant or change memories in people's minds. So this is a massive warning sign for any therapist using hypnosis. Any memory that comes up during a session has to be handled with extreme care because you just don't know if it's real or if it's a mix of fact, fiction, and the power of suggestion. So that brings us right back to where we started, mind control or medicine. Is clinical hypnosis this misunderstood therapeutic art, or is it a science that's still kind of finding its footing? We've seen its incredible power to help heal the body, soothe the mind, and change our habits. But we've also seen the serious warnings and the ethical tightropes. You know, maybe the answer is it's both. It's an artful way of using suggestion, but it's also a science that's still evolving, still carving out its own unique space in the world of healing. Definitely something to think about.